we just found out today this thing is evolving both quickly and it seems very slowly at the same time, which is the real challenge. Now that there are three confirmed cases in Kingston, how does that change what you're doing and what we should all be doing going forward?
From the perspective of the community and what we should all be doing, it doesn't change much. For the past few days, we've been reminding everybody of the importance of social distancing or physical distancing, because we want to keep those social bonds intact, but we want to keep our physical distance far enough that we're not spreading any virus before we realize we really have it or someone else has it. And so what we're recommending is, and we have been recommending for the past few days, is that concept of social distancing. Things like working from home if possible, avoiding visiting places like long-term care homes, retirement homes, or supportive housing, or other areas where a lot of people congregate and are vulnerable, avoiding non-essential trips into the community, or when we do have to go, taking steps to protect ourselves, staying again about 6 feet away from other people, limiting the times we go shopping, going at non-busy times, unnecessary shopping, maybe try online for now rather than going into the store, group meetings, group gatherings, going to church or mosque. It may be time to it is time to limit those now. And if you have to do something, try and do it online. So keep interacting with people, keep connecting with your family and loved ones, but do it online as best you can. And I think that I know that the province has put in a state of emergency and they've limited social gatherings as best they can under their powers, but it really comes down to us to continue that. From how it's changed for us, whenever we have cases of any disease of public health significance, including a disease like COVID-19, we put into place mechanisms to manage the case as well as the contacts of the case. And so right now, our staff are working hard to find out who the confirmed cases have interacted with and who that could be a close contact that is potentially vulnerable, and giving them advice on how to act moving forward.
Kingston recently opened a dedicated assessment center for COVID-19. Where is that located exactly, and what are the criteria for being tested? How does that operation function?
So at this time, it's located at the Hotel du Hospital. It's a separate entrance to the hospital. I think it's the St. Joseph entrance, right across from the parking garage, and it's well marked there. What we're suggesting is people go there if they require assessment for COVID-19, and those are people who have had recent travel and are sick with respiratory symptoms. We've seen a range of respiratory symptoms. Most commonly, it's a fever and a new cough, or an exacerbation or worsening of an old cough, but there are other symptoms associated with a cold that you may also have. But if you're well enough to stay home and you don't need to go, then we're recommending that people stay home, isolate themselves for 14 days, or for up until their symptoms get better, wait an extra day, and then continue out of isolation, I should say.
Because the symptoms mimic so many other things that we all deal with. We all get a head cold or a flu or a cold every year. At what point do you go, oh, this may be something more? And then what do people do? And what is that threshold? What are the real things that separate this from a common cold?
And that's a very good question. One of the things we've seen is we've tested a lot of people and only a few have come back positive. So that shows we're testing the people who we think may be infected, and the majority of tests that have been done in Ontario so far have been negative. So that shows that people had other things like colds, for example, and this is cold and flu season, and so many of the things we've been talking about, like washing your hands, coughing into your sleeve, etc., staying home from work when you're sick, they continue on this year too. What differentiates this disease from other diseases is that link, and it's hard to tell from the symptoms you have. 80% of people who have this have very mild symptoms, but the rest may have more severe symptoms. So it's that link to someone who may have been exposed. And that's why we're emphasizing that social distancing now, to reduce those links in general.
Right. How long does it take to get the results back from the test currently?
It's about 24 hours that we're experiencing locally.
Okay. So basically, if people believe they have symptoms, the self-isolation thing is becoming a big one. If somebody is isolating themselves, what is the process once they feel, hey, this is something I should be concerned about? What is the specific process that people should undertake then?
So if you're feeling really unwell, if you're having severe shortness of breath and feel you need to go to the emergency department, you should. If you feel like this is the same symptoms you've had as a previous cold and you know how to manage it and you'll be well at home, then you should stay at home and isolate yourself. That includes staying in a room separate from the rest of your family as best you can, not going outside, not leaving the house. For example, there's a really good document from Public Health Ontario that outlines everything you should be doing that I can provide the link for. And that's really helpful for not only the person isolating, but the people who are living in their house as well. In that case, we would ask you to call your family physician and they can provide you with that advice. Or if you're saying, I'm isolating myself at home, I'm not going to go get tested because I don't feel like I'm severe enough and I don't want to overburden the system, then you can call the public health unit and our nurses will give you that advice.
Okay. How are hospital staff and the public being protected from this?
One of the things, so for the public, that's why we're asking each of us to do our part with the physical distancing and the social distancing to protect all of us. We're also working from the health unit to find all of our cases, their contacts, and asking them to also isolate. In terms of at the hospital, there's screening checks now. And those screening checks have been in place and are now ramping up as well. There's also personal protective equipment that hospital workers are wearing so they don't get it and they don't transmit it to other people. We're also asking healthcare workers who have recently traveled, and anyone really who's recently traveled in the last 14 days, to stay home in the event that they would have picked up this disease while they were away.
So if somebody has questions, doesn't know, there's a lot of disinformation too.
Correct.
So Dr. Google is, you want to be careful. What are some of can you list some of the specific places people should go for good information? You mentioned the health unit. We'll put that graphic up.
So the health unit website is a great place, kflapublichealth.ca/coronavirus. Ontario.ca/coronavirus. That's a good spot. Public Health Ontario will have a link, and the Public Health Agency of Canada all have dedicated pages to coronavirus, COVID-19, and that has the best information. We are receiving more calls than we're able to process right now, and so people are waiting. A lot of the information people are asking for is available on the websites, and that will save you a lot of time by going to the website, seeing if your question is answered there, and it can provide a lot of good, reliable information, because you're right that there are a lot of forwards and a lot of messages going around, and they may not have as reliable information as the websites themselves.
What does somebody do if they're not an internet person, let's say an older person who's isolating themselves? How can they, and they're watching this on TV or whatever, how can they get information without going to the web? What other sources are there?
There is news on TV that is covering a lot of it. I think that some of the news, or the radio, for example, I listen to the CBC News on my drive in and out of work, and they will have, especially on their morning shows and their afternoon shows, how to isolate. They'll have segments on that. There is you can always call Telehealth Ontario. They may be able to provide you information.
Do you know that number offhand? We'll put it up.
Yeah, that may be better.
There you go.
But again, the wait times for telehealth are also quite long right now. And then the health unit does have a call-in line, but again, the wait times are quite long. And so if you are able to access it, the internet is the fastest way, but the TV can also help you. But if you're unsure of how to self-isolate, there's always somebody there to talk to you about it and guide you through it, but that information will be more quickly available on the website.
One of the things that I know I find disturbing about this is I think it was 70% of people are projected, maybe more, to get this, and a lot of them are never going to know they even had it. So is this not just about protecting oneself, but is this really a wake-up call to protect our fellow citizens?
Yeah, it's to protect our communities, to protect our loved ones, our friends, and our fellow citizens, exactly as you're saying. And one of the things we have to shift from is, I don't want to get this disease, to I don't want to spread this disease. And that's an important concept we all have to remember. So as you're saying, 70% of people will be fine. We don't know who that other 20 to 30% who will be really sick is. And some people may say, well, it's only, the young and healthy will be okay. There are some young and healthy people who won't be okay. But even still, those are members of our community. Everybody is a loved one of somebody else, and everyone's a human being who we have to respect. Even if we look at the numbers, as a percentage, it may seem a low percentage, but because so many people could be affected, it can really overwhelm our healthcare system. And then we won't be able to treat everybody to the best of our ability. And that's why we're asking for these social measures to be respected by everybody and have that distancing to allow us to slow the spread of this virus.
Okay. Finally, obviously, children are of a main concern. I know that the virus itself tends to attack people with older and with immune systems. Children, though, don't have a fully developed immune system, but more importantly, how do you keep the children healthy psychologically? What can we do to help our kids get through this when they may not really understand what's happening?
Yeah, I think so. Children are very unique in these coronaviruses, especially the severe ones, where they're not getting as severely ill as others, but they still can act as a vector, or they can still spread the disease within the population. And so that's why the provincial government has taken the step to close schools and daycares. But mental health for everybody is really important. And we do have some guidance on our website. So some things you can do to support yourself are taking breaks from watching, reading, or listening to news stories, especially social media. As we sit on our phones, there's a constant stream of information, and if it's negative, it can really bring us down. And again, we use those credible sources like the Public Health Agency of Canada or our other websites. Taking care of their body, getting them outside, getting, not just children, all of us outside, eating healthy, sleeping well, getting some exercise, avoiding alcohol for everybody, but for especially avoiding smoking. This is a great time to quit smoking because smoking affects your lungs, and this disease will will also affect your lungs. Taking time to unwind. So, on Sunday evening, I said to my wife, we're both just going to put down our phone for an hour, no looking at anything, and we'll watch an episode of something together on TV. Connecting with others, although we're asking you to physically be distant, you don't have to. You can continue to use your devices to connect with people and talk to them. One of the benefits of all this technology is the ability to do that as well. And supporting our community. So looking out for your neighbors, making sure that neighbors have access to food. If they're elderly especially, you may say, I'm going out, can I pick something up and leave it on your porch? For example, and continuing to be there for one another. And that includes being there for children, making sure they're getting out, making sure they have activities planned, and taking care of yourself, because if they will sense it from us how stressed we are too.
So is there anything that we haven't talked about, that I haven't asked you about, that we haven't gotten to yet? Is there anything that you'd like to add? What is the most important thing, do you think, that you can add to this and that our viewers can take home with them about this thing?
Oh, it's a scary time. This is something that many of us have never experienced to this degree, and I hope we never have to experience again. And there's a lot changing very quickly, and things that were true today may not be true tomorrow. But it can be very overwhelming. So I'd say take care of yourself and take care of your community. There's an element of responsibility we all have to look out for one another, and we're starting to see that happen more and more and more, and it's nice to see. If we all do our part, we can slow down the spread of this virus and give us time to put into place measures to treat people, or hopefully there'll be a vaccine eventually, but we don't know how long it'll be. But it gives us an opportunity to then manage it and keeps it at manageable levels.